Good morning. Welcome to Bayshore Guest Home and Gardens, dear administrator and today's seniors. Today, once again, we are addressing the issue of medication, opiates, and seniors, and how to help our seniors. And our guest today is William Toth, licensed mental health counselor, and also at the Apex Behavioral Center in Port Charlotte. Is that correct?
Yes.
William, you know that one of my big issues is the fact that a lot of seniors have fallen through the cracks. And this is a generation that has given us so much and has so much more to teach us. But because of this epidemic of addiction to drugs, which you deal with daily, they're falling through the cracks and they have no help whatsoever.
Yeah, I was just looking at a stat a couple minutes ago, actually, that says that 8% of the homeless population in Florida is elderly folks, and also I think 5% in Sarasota, Florida. And I'm seeing it more and more in my office, more and more people coming in with mental health disorders that are elderly and are having difficulty finding shelter. So I think this stat is actually on the low end, and I think we're going to see an increased amount of homeless elderly people as as this year progresses. So obviously we want to start to address this and hopefully start to, help these people find means to find shelter.
So you're on board with us to help us achieve this?
Absolutely.
And part of it is also that a lot of the behavioral or dementia that they deal with, and because of the lack of correct medication, what happens then is they self-medicate.
Right.
And that is a problem.
And that's really the culture of, most of the culture in homelessness is this self-medication, be it either alcohol or street drugs. So yeah, absolutely, that's something that's common. So what is it that you plan on doing here at Bayshore with regards to helping this population?
Well, I'm going to do some interviews with some of the shelters to see what it is that they need. We intend to have a drop box that anybody can bring, and that'll be, sort of in the next couple of weeks. We handle medications differently here. We are in constant contact. We have a doctor that is basically available 24/7 for house calls here. And when we have had a resident or someone who has come and they basically have been on an opiate or they have been on a benzoid for a period of time, and we notice a pattern of self-medication and drug seeking because it is a physical malaise that they feel.
Absolutely.
We work with a doctor and do very slow weaning off. We also are on what we call, all our medications are on lockdown. We count our narcotics at each change of shift. Our staff is drug tested. We are an electronic MOR, which takes the human error totally out of the equation during a med pass. And should a med pass, especially when we're doing the weaning off of medication, should that medication not be passed, I get paged that the medication is 15-minute late. So we avoid any discomfort if they are being weaned off of these medications and then being put on the correct medications for their mental condition.
Absolutely.
That's what we're doing.
Makes a lot of sense, and that's the best way to correct these problems. And obviously the first part is going to be awareness.
Awareness.
To raise awareness that this is becoming an epidemic, and then we have to start to adjust treatment and support.
Good. And you would be willing to come to Bayshore to help us and deal with the issue and sort of help us transition if someone needs that?
I would be more than happy to come and do some educational groups/classes with the population here at Bayshore.
Thank you very much,
My
William.
pleasure.
Well, ladies and gentlemen, thank you for being here. In the next couple of weeks, we will be working and interviewing several administrators of shelters. We do wish to shed light on this, and we would like to have a drop box, possibly do a fundraiser, but in the meantime, anything that you have extra that you do not need, we will have a drop box and our staff will make sure that it goes to the different shelters for seniors. On behalf of Bayshore Guest Home and Gardens, dear administrator, and today's seniors and Thank you for watching us and all the support that our readers have given us. Good night.